My name is Samantha Sajak, and my partners Callie Savage, Claire Krakowski, Caitlin Leduc, and myself decided to do our project on the lack of in-home monitoring and its effect on insufficient patient data. The thesis for our project states, with healthcare concerns rising in America, many physicians are missing out on pertinent information regarding their patient's daily routine. Missing out on the patient's daily information increases healthcare costs, increases hospital admissions, and worsens medical conditions. This essentially states that the lack of knowledge on a patient's health status throughout the day outside of a hospital setting has a significant impact on the organization as a whole. The problem with this is that lack of patient data can leave gaps in medical records for physicians, which can lower the accuracy in how physicians treat the patient. With healthcare concerns rising in America, these diseases such as diabetes, Parkinson's, cystic fibrosis, among others, need constant monitoring in order to best help the patient. In fact, many conditions should or do require constant monitoring of the physiological aspects of the patient. Even pregnant women and their fetus's blood pressure and heart rate should be constantly monitored to ensure that both the mother and child are in good health. Another issue presented is that while Obamacare has given health care to millions of people, it makes it increasingly harder for others to access caregivers due to the dramatic increase in patients. Additionally, extra tests must be run to determine the cause of the problem a patient is experiencing. This can cost thousands of dollars in MRIs, CT scans, and many other advanced tests that can often lead to no significant evidence of the problem. This modern issue does not only affect patients, but society as well. With these diseases increasing every year, the spending of Medicaid is increasing with it. This creates busier hospitals, which in turn creates less accessible health care for everybody. Physicians miss early signs of health problems due to the lack of in-home monitoring, which results in extra tests and preventative measures that become very costly, as mentioned as a problem in the previous slide. This lack of medical supervision creates a burden on the family, friends, and caregivers that continue to oversee the patient when outside of a healthcare setting.
Hi, this is Callie Savage, and I'm going to be talking about our solution. In our particular healthcare problem, we believe that there should be the implementation of remote monitoring devices like a smartwatch to monitor patients in their day-to-day routine at home. Icogen is a company that has a smartwatch that monitors health and activity data in real time for physicians. This solution allows patients to learn about their own body and how to self-monitor. User-friendly technology promotes patients' engagement in their own health. The company Care Innovations uses a tablet-like device that's easy to use for all patients. This user-friendly setting allows patients to feel more comfortable. And data shows that better engaged patients want to engage more with their own healthcare. Also, remote monitoring gives honest data about daily activity, which is really helpful as some patients may be embarrassed to tell the truth about their day-to-day lives. Physicians would be able to monitor their patients and be alerted when severe changes occurred. An example is a patient's systolic blood pressure decreasing across a certain threshold. A physician would then be alerted immediately to this decrease. Also, there will be an improvement in communication between the physician and the patient. This is because the patient will know that they are not alone, as healthcare providers can quickly respond to the influx of data. This constant data will improve communication over time. Also, this remote patient monitoring also allows physicians to treat more patients in an inpatient setting. This remote monitoring solution will also lessen the burden of at-home caregivers. A study at the Ivy International Center for Health Innovation at the Ivy Business School created a year-long study using remote monitoring, where caregivers stated they felt their burden was lessened and that a patient could self-manage. Along with that, as a physician was always available, and they felt their relationship with the patient's physician had improved. Lastly, the solution of remote monitoring can be tailored to each patient. There's also a decrease in the cost spent by Medicaid. Coming up in our supporting studies and statistics slides, we have seen a very large trend of a large decrease in costs using remote monitoring. Lastly, the company of Care Innovations is a major company that has been using remote monitoring with all of their tablet-like devices, and they also teach classes on how to implicate remote monitoring in all healthcare settings.
Supporting studies and statistics. In one study, patients assigned to remote monitoring experienced reductions in hospitalizations, emergency department visits, and length of stays. In the same study, there was an average cost of $2,931 with the remotely monitored group. Patients with Parkinson's disease saw improvement concerning balance and less deterioration when using remote monitoring over a 6-week period. Care Innovation boasts an 80% engagement rate. Another study done by St. Vincent used report monitoring and reported 64% less readmissions. One woman with 9 chronic conditions and 11 admissions within 1 year had no readmissions over her 7th-month trial with remote monitoring. The Mississippi Telehealth Network was established after seeing a 1.7% decrease in HbA1c, a 13% increase in medication compliance, 9,454 miles saved due to not coming into the hospital, and a saving of $339,184 after using remote monitoring for 100 patients with type 2 diabetes. A study at the Ivy International Center for Health Innovation at the Ivy Business School created a year-long study using virtual care management and saw the potential to improve patient, caregiver, and provider experiences of care along with improved self-reported health outcomes. They also saw they could reduce the cost of the current healthcare system. Patients felt more secure by having a professional standing by in case of questions or emergencies. 86% of users stated the software was easy to use. 89% of users stated they would recommend the software. Caregivers stated that they felt their burden was lessened in that patients could self-manage. Caregivers also felt less alone as physicians were available. Caregivers felt their relationship with physicians improved. Providers stated that they felt their work increased while trying to learn the new program, but overall resulted in less work, as problems were able to be caught early on and less preventable measures could be taken. Providers stated patient compliance increased. Reductions in hospital admissions accounted for most of the costs saved. The Cardioband is a novel technology that enables patients to record a rhythm strip using an Apple Watch. The band is paired with an app providing automated detection of atrial fibrillation. The study was conducted to see if the Cardioband would recognize sinus rhythm and atrial fibrillation. Patients with atrial fibrillation presenting for cardioversion were enrolled in the study. The Cardioband recordings were reviewed by blinded electrophysiologists and compared with the ECG interpretations. During the study with the Cardioband, sensitivity, specificity, and K-coefficient were measured. The results showed that the Cardioband interpreted atrial fibrillation with 93% sensitivity, 84% specificity, and a K-coefficient of 0.77. With physician interpretation of the Cardioband, there were recordings of a 99% sensitivity, 83% specificity, and a K-coefficient of 0.83. The Cardioband for atrial fibrillation detection, supported by physician review, can accurately differentiate atrial fibrillation and sinus rhythm.
Our audience is primary care physicians, emergency room physicians, the consumer, and at-home caregivers. For primary care physicians, they can use this data to monitor their patients during their daily lives, can see results in real time in a natural setting. The emergency room physicians can use this data to quickly analyze the situation. They can tell many important details about a patient's health. They can also see how long a heart attack was, if they had a seizure or a stroke occurred. They can also see the O2 levels that they have. The consumer can use the technology to not only be more health conscious, but learn more about self-monitoring. For at-home caregivers, they can feel at peace knowing their patient is monitored. The improvement in their relationship with the physician as well. We found a video about Apple. They're creating an EKG monitor for their watch.
exactly is Apple working on here? I mean, the Apple Watch already monitors your heart to a certain extent, but this is different.
Yes, this is, as you say, the Apple Watch as it stands can monitor your heart rate. But of course, that is basically in the moment and historical. It shows your heart rate extended over a certain period of time. What an electrocardiogram, an EKG, it's the device which they're developing. We don't yet know for certain whether it will come into the watch, but it's something they're working on. What that is able to do is anticipate future cardiac events. You know, it can see perhaps he's more likely, he's possibly going to have a stroke or has got a blood clot and therefore should go and see a doctor. And it's that sort of predictive and preventive medicine and healthcare which is a really huge opportunity for Apple potentially.
So, how does this fit into Apple's overall plan?
This preventive idea is crucial. Apple has been talking a lot about the prospects for healthcare. It's a huge, huge industry, as we know. Trillions of dollars, set to grow by as much as a third over the next 5 to 10 years. And so Apple is therefore trying to position the watch and its palette of products towards the healthcare industry because it senses it as a greater opportunity than just for luxury products, as, for instance, the watch was marketed to begin with. It was very much a luxury piece of leisure wear.
So in conclusion, implementing remote monitoring can save money, save patients. It allows the patients to learn more about their own body and promotes patients' engagement in their own health. They engage patients and caregivers. It allows physicians to treat more patients, lessen the physician workload, and easily track physiological factors. It also improves communication between physicians and patients in the healthcare field.